And now to a record that no one wants to see broken. As coronavirus cases continue to rise, so do the number of people experiencing the worst of the symptoms.
Today, North Carolina reporting its highest number of hospitalizations since the pandemic started. And now for the first time, we're hearing from the hospitals who say they have concern about being overwhelmed. Take a look here. North Carolina seeing a 7-day average of new cases above 1,000 each day, along with the hospitalizations, that record of 829 right now. It's the same story in Mecklenburg County. During the past week alone, an average of 106 people in the hospital. And you can see that average has not dropped since mid-May. Channel 9's Mark Becker spoke to a hospital today. And Mark, I understand they told you the current trends are a concern for them.
Yeah, they think they can handle everything as it sits right now, Scott, but the trend's certainly going in the wrong direction. Numbers not going down, but they're going up. And the clinical director here at Novant Hospital said he thinks that's because a lot of people aren't taking those safety precautions seriously enough anymore. They've been on the front lines from the beginning, and so far hospitals here have been able to handle all of the coronavirus patients. But that could get tricky. COVID hospitalizations across the state hit a new high today at 829, with 74% of hospital beds and intensive care beds now occupied, numbers that have the full attention of Governor Roy Cooper.
And we continue to be concerned with our percentage of positive tests and our hospitalizations.
This afternoon, the chief clinical officer for Novant told us they're seeing the increase here in the Charlotte area.
Especially the last week or so, we have seen concerning trends in the number of COVID positive patients that have required hospital admissions.
Dr. Sid Fletcher told us that after a lull in caseloads in April, the numbers have gone back up again. Because as the state has begun to reopen, many people may have let their guards down, not wearing masks or social distancing, and so hospitals are gearing up for even more patients.
I don't believe that within the models that we're seeing that we think that there's going to be a massive spike. I think we do think that we're bracing for a period of some sustained inpatient need. So we are ready for that and approaching it that way.
And Dr. Fletcher said 3 months ago they were also gearing up for a surge, perhaps. That really didn't happen, but he says there's one big difference between then and now. We'll have a little bit more on that coming up on Eyewitness News at 6. Scott?
All right, Mark, thank you very much. And now other trends in the county are also high. This is the percentage of positive cases. The orange line is a 7-day average, and it's at the highest level in 2 months. And there was a lot less testing going on 2 months ago than we certainly have now. A lot of testing happening. This shows the number of new cases every day. It's been above 200 at least 8 times this month. Before that, it had not hit 200 once. But again, we're doing a lot more testing recently. But some people argue that's not the only reason for the increase in cases. We're not just finding more cases that are out there. More people are catching it through social distancing, or I should say a lack of it, at a 3-month low within the county. That's according to Mecklenburg County, and they say they know it's at a 3-month low based on data from a University of Maryland study.